Anybody that gives you a hassle or doesn't give you that information, then let me know. I'll come have a talk with them.
Okay.
I'll let them know that I'm asking for 350,000 people.
Result came in.
Oh, yeah? What is it? We got another negative result. This is P.U.I. number 3.
Yeah.
Okay.
Just barely came through.
That's terrific. If you could have them give him a ring and let him know. Okay, so there you go. Hot off the press. P.U.I. number 3, negative for COVID. That's SARS-CoV-2. Okay, and it's my understanding he was feeling better anyway, so awesome. So that means our first 4 tests are now negative. We have yet to find a case of COVID in our clinic. We're going to start every video with immediate updates on Marion County and what's happening here locally. As of late last night, Marion County is now at 22 cases, still no deaths. Number of cases in the United States now up to 145,000. We have an update on Abbott Laboratories. That's the 5-minute rapid test that the president talked about at the press conferences over the weekend. We've been in touch with Abbott Labs. It would be at least 1 month before we would be able to get any of those kits here in Marion County. So we cannot hold our breath for that. We'll have to persist as we have been with the commercial laboratories that we're using. We also have found that Henry Schein, it's a supply company that many clinics order from, has an IgG and IgM finger stick blood test looking for antibodies to COVID-19 virus. That would be extremely useful, so we're going to see if we can get a call back on that. We have not yet heard back from anybody on that. I suppose that Henry Schein's awfully busy with phone calls this morning, as we all are, so we're going to work very hard to get the updated finger stick antibody test. Updates for the testing sites for Marion County. As always, Trinity Clinic is a testing site. We're receiving more and more calls. We're doing more and more tests for COVID here in the clinic. We have space. Like I said, we want to keep the cases as low as possible in Marion County, and a part of that is early and often testing, so we are open and ready to go. The UF testing site down in the Villages appears to be completely booked out online, so we're going to see if we can get some more information about that tomorrow. We're going to have to remind me to do that. There are a number of other local clinics that are doing tests as well. We're going to see if we can compile that list and have that list ready to go for tomorrow's video also. I drew this graph last week about flattening the curve. So this, by the way, is not 500 beds. It's maybe something like 1,100. I'm going to create a real-time curve tracker for Marion County, but I need the total number of hospital beds, which we have been unable to get as of yet. So we're going to continue to work hard to figure out precisely how many hospital beds that we have in Marion County, and what the number of empty beds per hospital as well on a day-to-day basis, as well as tracking the number of COVID cases that are admitted into hospitals, so we can start to see how close to the capacity that we're reaching in our county and to track that day by day. So that's something that I hope to get up and running here over the next day or two. It was a Monday. Watch, you'll see. Roll. Good morning. Let's get updates for everybody.
Okay.
We want to do health status for P.U.I.s that are remaining. We have 3 back that are negative. I spoke to number 4 already over the weekend, so she's doing better. I still haven't been able to reach number 3, and let's check 5, 6, and 7 as well.
Okay.
And let's have a check-in on our watch list also and see how they're doing. Okay. Can you print that for me and put that on my desk? We'll get that whole list. And then I'll need Tatiana when she's done, but she's busy. What we're doing right here, this is gonna be our wall of results. So we've got results for P.U.I.s 1, 2, and 4. We're still looking for 3. Don't know why that one's back yet. And we're gonna keep a running list. These are all negative so far, which is good news. It's what we want, negatives, but we wanna find every single positive in this county that we can find. So that's our efforts this morning. How many are we testing this morning? Do you know? 2 plus we might be adding the other one that she's calling on now. Have you reached her?
So she says that overall she does feel a lot better today. Last night she had dizziness. She just went to bed.
Okay.
Her fever's low grade. It goes up and down, but nothing, like it doesn't go higher than what it normally was.
Okay.
Minimal cough, but she says she's getting these cough attacks.
Okay.
So, and then she feels like someone's sitting on her chest.
So she sounds like someone we could test, possibly. Let's get her, if it's okay, let's get her on the watch list,
Okay.
and let's go day by day for her as well.
Okay.
Can I get the names and ages of all three that we're going to test for today then?
Yep.
Because, well, no, actually, we're not going to test her, so it's still just the two. Wow, this is like a little classroom I have right now.
I'm taking my notes.
We got notes.
I see why we have bouncy balls for kids nowadays.
Good.
We're at 22 cases in the county now. So that blew up over the weekend, right? Just like we were expecting. We knew that it was going to. I'm going to be building a real-time flatten the curve graph for our county that we're going to track day by day by day. So what I'll need you to do, Tatiana, please, is to call all three local hospitals. Call the admissions department. Let them know that you're calling for Dr. Kuhn. Because we're leading this COVID-19 community response, we need to know the total number of hospital beds that the facility has, each of them. We need to know how many people are admitted right now, or in other words, how many empty beds do they currently have. And that's a day-by-day thing, of course. It changes daily. So each one will have the total number of beds and how many people are admitted right now. And then we need to ask them as well how many COVID patients they have admitted into the hospital. So with that information, plus what we can get from the health department about who's admitted and who's not, then we can begin to track the curve for Marion County. So we're gonna do that every day. This will be a cool exercise. I think that people will like this, because then we can see how close we're getting to capacity in our county. And I'll tell you, we're already gonna be close to capacity in our county because the hospitals are already pretty full.
But they're building the field hospitals, which will.
You're gonna wanna ask them. I know Advent did that. I don't know if ORMC is doing anything like that to expand the capacity of the hospital, but Advent is. So they were supposed to add something like 100 additional beds. That's probably, because that was from our first video like 2 weeks ago, so that's probably up and running. So ask about that too for Advent and ORMC. So that's important. So let's get that done this morning.
Okay.
Anybody that gives you a hassle or doesn't give you that information, then let me know. I'll come have a talk with them.
Okay.
I'll let them know that I'm asking for 350,000 people because they all want to know. The other thing on you, if you can call, this one's a little more of a challenge. So the two labs, we talked about the IgG finger stick antibody test that's available. That's Arrayit, A-R-R-A-Y-I-T, Arrayit lab. I want to know everything about it. I want to know, is there a machine that we get? Can we order kits? I believe it's a finger stick blood test, and maybe we just mail that sample back and they analyze it there, or do we need like a machine to analyze it here?
$50,000 machine
Yes.
to do it here. Okay.
So that's one. So that's the antibody test we're very interested in. So let's get answers on that this morning, please. And then the other one is Abbott Lab. Abbott Lab is the 5-minute one that they announced at the press conferences, and it was in the news over the weekend. So let's see if we can get answers on that. Those are the...
How it works.
How do we get kits? Do we need a machine? What's the availability? If you could let them know that I'm asking for 350,000 people. Let's see how many kits we can get. I got one more. This can be a coin toss on who wants to do this one, because this one's, I have no idea how you're going to get an answer on this.
All
This is a
right.
challenge.
We'll do after we find out what it is.
Okay.
Rock, paper, scissors.
I want to find out from the state health department. Now remember, the state health department is fairly busy. You know, they have their hands full. So, but just to see if you can get anybody on the phone that can tell us how many test kits the state of Florida has received from the federal government so far.
To date.
Yeah, up until now. And then see if you can find out the allocation procedure on that also.
Okay.
I would imagine that Miami-Dade, which is getting hit the hardest, probably has the highest priority for who might receive kits, but I'm wondering how many the state of Florida even received in the first place. You know, they released like 1 million kits maybe.
20,000.
And we got, you know, or 100,000, but then we got to divide that 100,000 among all the counties, and so the numbers get smaller and smaller and smaller as you have to distribute that. So I'm interested, or maybe we got 1 million kits in
Ready?
Florida.
Rock, paper, scissors. Rock, paper, scissors, shoot.
Oh wait, you got to do it again. You
Paper, scissors, shoot.
So who wins?
Calling. So I'm calling.
Oh, so you're gonna have to call on that.
It's okay. We'll do it. We'll do it. We got you.
The more people on the phone, the better.
As many as you can get, but let's see if we can get answers on those
Sounds
things
like a plan.
this morning.
Oh, I should have gone.
Wait, that's harassment.
That is. That's
Hello?
Okay, how was that swab?
It was horrible because it goes in the back of your nose.
Really? It was that bad?
No, it wasn't that bad.
Okay, you're gonna scare everybody online, you know that.
No,
right.
it's not that bad.
Okay, so it's Monday today. Last Monday when we did a test on somebody, we got the results back that Friday. So
Okay.
let's hope we have your results
Okay.
by this Friday.
Okay.
In the meantime, you're isolating, right? Okay.
Yeah, I'm at home with my kids. Like, I'm not.
Not going out or doing anything like that?
Mm-mm.
Okay, good girl. If you need us, you
Yeah.
call us anytime,
Okay.
all right?
All
That's
right.
it.
Thank you.
Thank you.
Bye.
I can't find anything on Array Labs, but this says that Henry Schein is gearing up to ship COVID-19 tests to physicians and hospitals. Blood prick taken, IgM, IgG, duo, 15 minutes.
IgM and IgG.
Duo kits. Henry Schein.
Okay, this was March 27th,
Yeah,
so
but
3
it
days
said,
ago.
anticipates having at least several 100,000 tests available by March 30th, and today is March 30th.
Okay, so that's a new lead then, Henry Schein.
Yes.
And what's the name of the company? That's
SD Biosensor.
okay, so let's make those notes. SD Biosensor, you can't find Array it anywhere,
No,
huh?
I can't find it anywhere. There's nothing on it.
Okay, I'll look at that message that I got and see if I can find
I can't
what that
find
was all about. Just running through.
Kelsey. Hi, Tatiana. I'll give you a virtual hug.
Welcome back.
A virtual hug.
Yeah, it's like an air hug.
Yeah, air hug.
Air hug.
This one's
Okay.
established care.
Yes.
She's not a patient of yours. Her daughter's on the phone. She has a cough, very dry. It's getting worse by the day. A little over a week. Fever, 100.4 between 100.8. Staying in that range. It's not getting any lower than that. She has crazy headaches, body aches, and shortness of breath. She wants to know if her mom can get tested.
Yeah, she's gonna need to be tested with those symptoms. That's a pretty easy decision. Cough, fever, headaches, body aches, shortness of breath. That's fairly classic for COVID-19. So we absolutely want to test her and more people like her.
Okay.
Is she isolated, do you know?
Yeah, she's home alone. Her daughter's been talking to her over the phone.
All right, so let's make sure that she stays isolated and let's get her maybe on for tomorrow AM.
Okay.
Okay, that's more tests. We need them. Every test we can find, got to root it out, and I'm going to get blurrier and blurrier at once.
Yeah, we're gonna have like 4 people added.
All right, who's
this
first?
is a Facebook viewer.
Okay,
She said she went to the hospital and they couldn't do anything for her. She had a tight chest. Her fevers have been between 101 and 99. She's coughing really dry, but it's not persistent, but it is really dry. Body aches. She has a headache. She says it's really bad from her temple down to the back of her neck and her shoulders. Like it just hurts.
okay. Yeah, has she been swabbed for flu, do you know?
She said she hasn't been swabbed for anything.
Okay, so she sounds like someone that probably needs to be tested. We just need to find out if she has any sick contacts.
Okay.
But she was in the hospital though,
Yeah, she
so there
did
could be
go to
some
the hospital.
exposures there. All right, so yeah, let's get her scheduled. Who do you have?
Also a Facebook viewer.
Uh-huh.
His wife actually works for the health department, but he, according to the health department, he does not qualify for their testing kit.
Okay,
The energy was just zapped out of him.
so 12 days ago, started.
And then, yep, that's when it started. He said that he slept. He was so tired. He had a severe sore throat, worst he's ever had. Then he's had a cough come along after that. Fever is 105. Body aches.
His fever is how much?
I mean, 100.5. Sorry.
Okay. All of us, even the cameraman was like, what? I know.
He said he started actually feeling a little better, but he still has his dry cough. He has a kid that works at Publix and a kid that works at Chick-fil-A. And his wife is testing for the COVID-19, so he's concerned.
His wife is doing testing for COVID?
Yeah.
She's like swabbing people?
Yeah.
All right, so yeah, let's get him tested too then. That's pretty classic. I'm gonna need help over this next probably 2 weeks because we're gonna be getting, this is gonna be increasing, right? As of late last night, we're at 22 cases. Look at what the calls are doing now. And these people are going, they're stopping at the hospital, but they're not able to get testing done because we still don't have kits.
Yeah, he said his wife asked her job and they told her that he didn't meet the qualifications.
All right, well, he meets my qualifications, so let's get him and get him tested. Yeah.
HQ Emergency Operations is not available. Record your message after the tone.
How's that going so far?
I'm just leaving messages after messages after messages. I can't get a person on the phone. Anywhere, nowhere I call.
Terrific. This is the food procedure. Here we go. Grab it. Hey, I need to get updates on those hospitals too. I just need to know hospital beds in Marion County. So what's the answer?
So apparently no hospital, no local hospital in administrations, admissions, not even the nurse, head nurse. And apparently they cannot disclose any of that information to me. I have to speak to leadership in administrations or HR.
Just to know the number of hospital beds in the hospital.
Even to know if they're doing an expansion, like to add like a field hospital or any hospital beds or anything like that.
I already know they're doing that.
Yeah, and she said she can't give me that information.
She can't even tell you how many beds are in the whole hospital.
She's like, even if I wanted to tell you, I can't give you that information. You have to speak to leadership in
Okay, so
administration.
burn up administration and leave messages for them to talk to me then?
Yeah, that's
They'll
what
probably-
I did. And I left my contact number, our number, and I left a voicemail for human resources to call you back.
Okay, let's call 3 times a day until
Okay.
somebody calls us back every single day.
Okay.
Ridiculous.
Yeah.
Just need the number of hospital beds and I can't even get an answer.
Can't get that, nope.
Okay, questionnaire. Don't even know why I'm wearing a mask because I'm standing 15 feet away from a car with closed windows, but
I'm like,
I'd better to be safe than sorry.
she's like, it's in the air. I'm like, roll your
I don't know.
Party is reached.
There we go.
Oh yeah. So how long have you been sick?
Fever started Saturday.
Okay. How high, do you know?
It's gotten up to 102.2.
We'll for sure swab you, of course. Any exposure that you think you might have had?
I'm a nurse.
Oh, you are a nurse? Well, then you know what a flu swab is.
Sure do.
So we'll start with the flu swab, make sure this isn't the flu. And then, of course, it's a rapid flu, just a couple of minutes. If that's negative, then just like before, then we'll do a COVID swab. I gave her the instructions on the window procedure, so that ought to be clear. She's not been swabbed for flu, so we'll flu and then COVID her 100%. All right, you're ready to go.
So I'll update you on the Abbott.
Okay, Abbott Labs. So this is the 5-minute rapid test that we heard about on the news over the weekend. I'm sure you heard about that. Did you watch?
Oh yeah, I was rolling.
And you were thinking, oh great, we're gonna have a 5-minute test. I can't wait.
It's called the ID Now COVID-19 5-minute rapid test. I spoke with David at Abbott Labs. He said that they just barely rolled it out 2 days ago.
Yep.
Made the announcements. He said that the first shipments are going to be coming out at the end of this week. They're rolling them out with the guidance of the CDC, and they're ramping up production as fast as they possibly can right now. And all of the first tests are going to be allocated to the major COVID-19 hotspots, including California, New York, Seattle, Illinois, Connecticut, and New Jersey. And they said the second phase 2, will be rolling out after that, depending on production, to states like Louisiana, North Carolina, and other areas that are affected with higher mortality rates.
So we're weeks and weeks from availability for Florida.
Yeah. So he said independent clinics, such as clinics like ours, are looking at 3 to 4 weeks until we could potentially get a test. He said, but again, it's dependent on production. Florida hospitals are part of the stage 3 rollout. Hospitals are above independent facilities. So I'm
Okay.
assuming we're
The Abbott Labs 5-minute rapid test is unavailable in the Marion County area for probably a month anyway. So there it is, straight from Abbott Laboratories. We're not on the list, Deb.
There's no getting on a list right
I
now.
think we'll be lucky if they were on the list in a couple months.
Hey, make sure that you get Miss Deb on film though, because nobody's seen her.
No, I don't want to be on.
Because of the exposure to the COVID positive person that you may have had at work, then the risk is high for you, you know that. He works with somebody who tested positive for COVID.
Okay.
We already know about the hospitals. The hospitals are not releasing information. We're calling multiple times a day until we get an answer on that.
Okay.
So, State Health Department, were you able to get anybody?
So I've been on the phone for hours, going round and round and round and round, and then finally I was able to reach the epidemiologist for the state, and he said he can't give me that information. He doesn't have it.
He couldn't or wouldn't?
He didn't have it.
Okay.
Then I was finally able to reach someone at the COVID response department for the state. This was from the distributions and response team.
That sounds good.
They could not tell me how many kits have been released from the federal government, how many test kits. They said that the only information that she could access or give me was that the state has requested 500,000 test kits. They said that they're prioritized, the allocation is prioritized by the number of positive cases in a county.
They have received 500,000 kits?
No, that's how many they have requested.
They've
to
requested,
date.
but they didn't say, so of the 500,000, they didn't say if they've received any of the 500,000, or they wouldn't tell us?
They wouldn't say, and I asked, I was like, is there somebody that you can connect me to that could possibly give me that information? And
Yeah.
she's like, I have no idea. If I don't have it, and I don't know how to get it, I don't know how you're gonna get it. I was like, okay, so
Wow.
I put in a phone call though. I do have a message in with Dr. Roberson's office. That's the Deputy Secretary for Health at the Department of Health. So I'm hoping I'm going to get a call back. She said she was going to call me back with that information. I'm waiting on it.
So we're looking for 500,000 kits to test 250,000 people. We have no idea if we've received any of those kits in the state of Florida or if any of those have been allocated. It seems like the state health department isn't too sure either.
Well, they can't give me anyone to talk to get that information, so.
Okay, so we're going to keep.
We're in
So,
the same boat.
and you have messages out to some people though, so we'll see if we get somebody
Yes,
to call
exactly.
back.
And then in regards to Henry Schein, they actually have an IgG and
Yeah,
IgM
right.
Antibody test.
Is that available?
And they said it is available, and someone would call me back with this morning to
Okay.
give me more information, and nobody's called me back on that.
So do you want to give her that information for the
Yes.
contact so you can stay on top? So Henry Schein has this finger
Yeah,
stick
I
blood
saw.
test, right? The IgG, IgM blood test. So we want to see if we can get our hands on some of those. So burn them up.
Okay.
Burn them up all afternoon. Call. We can give her all the contact.
5 to 6 days, she is immunocompromised, fibromyalgia, hypertension, really bad GERD, gastritis. She's had a sore throat 5 to 6 days, went to the ER yesterday. They wouldn't test her because she hasn't traveled.
Just a sore throat's all she's got.
Well, no, shortness of breath,
Chest
chest
pain.
pain, dry cough. Occasionally she will get something up and it's brown. She has no way to check her temp, so she doesn't know. She does feel like she's worsening. She's starting to have GI symptoms, body aches, headaches, which are worse than usual because it
Yep.
goes with the fibro. She said they're a lot worse than usual. She has tried taking Tylenol. It doesn't help.
Okay.
She was just recently in the hospital for 2 weeks on a heart monitor.
She was recently
Yeah, she's
hospitalized.
been experiencing a lot of chest pain lately.
So she could have some hospital acquired anything.
Right.
So let's watch list her then.
Watch list her and call
Yeah.
her tomorrow.
Yep, let's watch
Okay.
list her. That's a legit watch list. Another thing that we need to do, I need to get on the news.
On the news.
I need to get on the news, the local news about mitigation. Hey Deb, I need to get on the local news about mitigation. Is there anything that you can help me do?
I don't know about anybody in the local news.
You don't know anybody at the local news? If anybody knows anybody at the local news, what newspaper, Wesh 2, what are some
We could share your video to
Local.
Wes on Facebook.
We tried that, they're not paying attention. If anybody that's watching knows anybody at any of the news stations or anything, I want to go live, I want to go on the air, I want to talk about keeping cases as low as possible. We're up to 22, that was as of last night, so it's probably higher than that now, but we don't have word yet. We need to mitigate this, Deb.
Okay.
I don't want a single death in this county. You good? You rolling? Okay, very good. So, end of the day Monday, busy day today. We've done 3 tests, getting more and more calls in for people that are symptomatic of COVID. I wanted just to close though, just to show everybody what an N95 mask looks like. We've received a donation of a couple of these things, and I wanted you to see what a small and a large one, you can see the difference here between an N95 mask and kind of just a regular dust mask you might get at Home Depot or Lowe's. And this is adequate for what we're doing, especially when you do a double mask like the girls have been doing here. For the N95s, the seal is tighter and this is thicker, so it's better filtration for respiratory viruses. So these are the masks that are most in demand. These are the ones that healthcare workers are needing in hospitals. Any of these N95s that we get as a donation, we're gonna save these for the hospitals for when they need them, which they will. So that'll close out for Monday. As always, appreciate everybody watching. Much gratitude. Any questions, please drop those in the comments below. We still have a lot of work to do about hospitalizations to be able to track the curve for Marion County, which we want to stay on top of closely. Up to 22 cases now in the county. This is going to continue to grow. Expect that as test results continue to come in. Everybody have a safe night. See you tomorrow. Yes.
I was made for this. I was made for this. I was made for this.